Common cancer drugs are running short, forcing doctors to make some tough decisions about treating patients. The shortage is mostly because of supply chain issues. The National Comprehensive Cancer Network says 90% of cancer centers in the U.S. are affected. Fox's Austin Westfall in Charlotte, North Carolina with more. Austin?
So basically what doctors are saying is that they've dealt with chemo shortages before, but this one might be a little more severe than they're used to. There are 2 drugs of concern at this point.
Some facilities in the United States, we understand, actually have no carboplatin or cisplatin available.
Carboplatin and cisplatin are 2 of the most common chemotherapy medications, and the drugs treat many types of cancer like lung and testicular cancer. But right now, not every patient has easy access to them.
I was worried because I didn't want this to be prolonged.
Gail Lass needed carboplatin for stage 2 lung cancer treatment, but her doctor didn't have any and wasn't sure if he'd be able to find it elsewhere. Eventually, her doctor arranged for her to get the chemo at a nearby hospital.
Usually one of us can get the drug, but it's just become more of a challenge.
For now, Dr. Justin Favero says the drugs are being given to people with stage 1, 2, or 3 cancer. That's because treatment aims to cure the cancer in those stages. Stage 4 is when other treatment options are considered.
In stage 4 patients where they're not necessarily curable, a small change of one drug or one regimen to another wouldn't necessarily shorten their lifespan. It would just be not necessarily the ideal treatment that we would typically use.
It's going to get worse, I think, before it gets better.
A survey of 27 U.S. cancer centers shows that 93% have reported a shortage of carboplatin and 70% have reported a shortage of cisplatin.
The current estimates are that up to 500,000 cancer patients per year could be affected by the shortage of these 2 agents.
Now, Dr. Carlson says it's tough to know exactly when conditions will improve, but for the time being, the U.S. Food and Drug Administration says that they are working with a Chinese drug maker in order to boost drug supplies for now. In Charlotte, Austin Westfall, Fox 5 News.
Thanks, Austin.